Thank you all. Our guest, Dr. Perumal Cheramannan, BSc, MD Homeopathy, MSc Psychology, PGDHM, Hospital Management. Principal and Professor, Sri Sai Ram Homeopathic Medical College Research Center. Professor and Head of the Department of Organon, Homeopathic Philosophy, Sri Sai Ram Homeopathic Medical College and Research Center. 30 years of experience as homeopathic practitioner, 23 years of extended experience in teaching profession as a professor and HOD, 16 years experience as a principal. Awards: Best Teacher Award, Homeopathy by the Dr. MGR University, Government of Tamil Nadu. Best Principal Award by Dr. Mahendra Singh Trust in 2020. Accomplishments: Member and Board of Studies of Homeopathy, Faculty Member, MGR Medical University of Tamil Nadu, appointed as a member for conducting inspection for the grant of consent, affiliation for the establishment of UG, PG courses in Tamil Nadu Homeopathic Medical Colleges, appointed as an external examiner for the BHMS courses to various colleges across Tamil Nadu, and appointed as a paper evaluator and central evaluation for BHMS graduation for the Tamil Nadu MGR University, Chairman and Blood Donors Club in Sri Sai Ram Homeopathic Medical College, member in Government Council body of Sri Sai Ram. Today, subject: understanding local maladies in homeopathy. A great subject. We are always dealing with. I think that each and every doctor is having his own way of treating cases. We will not be the same for each and everybody. Today, the subject, he had taken many classes here, and he's an eminent personality. You can feel it now. Now, doctor, you can start now for the next 45 minutes for you. And after that, as a professor, as a board of member of faculty and board of studies, you may face many questions. So you are welcome, sir. Most welcome to our platform. Thank you.
Good evening to all, sir. That is audible?
Yeah, it is audible.
Okay. So I am very much thankful to our IFPH team for calling me as in this occasion. I am very much thankful to Dr. Sagani, sir, who is the guiding star for me. So today, actually, I am the organon professor. So just I want to give because we already know about the local malady. So just I want to convey what I learned from the Honeyman. Shall I share the screen, sir?
Yeah. Just a minute.
Yes, it came as the host.
I shall make you co-host, sir. Yeah. Now you can do, sir.
Sir, are you able to visible, sir?
Yeah, it is visible.
Okay. So actually, it is a main topic in our case taking, because sir is nicely took that our past session. So here we just discuss about the one-sided disease. Mostly, whatever may be the thing, mostly in our life, particularly chronic disease, mostly we can see that one-sided disease. So first, I am very much thankful for giving me the opportunity to explore my view in this occasion. And also, I am very much thankful to many philosophies and ideas will come and go, but the view of our master, Honeyman, will last forever. So today my topic is local malady. So instead of using the word skin eruption, what is meant by local malady according to our master, Dr. Honeyman? So whether it is only a eruption or anything else beyond that one. Because mostly, why Hanuman must give the importance means you already know about that one. Because most of the people are use that ointment. Nowadays also most of the ointments are prepared. Sulfur, graphitis and tuja for that warts and sulfur for eruption. And also Shankar or Bibo, we just apply the Mirsal because we in market all the ointments are available. So whether it is applicable or not, or whether it is a good or bad to apply for the problem. So when we see Hanuman, they didn't use the word skin eruption. It is only a local malady. So what is the homeopathy concept and allopathy concept regarding that? So mostly it is allopathy concept only local malady because it is pertinent to local and the rest of the body is not involved in it. Actually, we are doing the some of the few practitioners are doing the mistake nowadays also. But most of the old school or any treatment when we go, first they give the medicines or for the application of the external. Okay. So whether it is a good or bad, we don't know about that one. Because in market, some of the doctors or some of the pharmacies are most sold about the sulfur, graphitis, tuja. And extreme cases, I am not able to do. I am to tell anything else. So for the common one. So it is one of the one-sided disease. Because you know already about that one. Yes, you are the well-versed and senior for me. Because it is not for me to explain about the one-sided disease. But it is just I want to say something about the one-sided disease. Because nowadays we know about that one. Most of the disease condition, when it is uncommon peculiar symptoms, there is no problem for the curing. But when you take any case history, that patient is taking the medicine for 1 year or 2 years. So just we know what is the reason for that. Mostly when you say a bunch of case taking is there, if any patient who is taking the chronic, so what is the reason for that? Because according to whether we are mistaking or our principal is mistaking. Okay, we just to go or probe about the one, we can able to get an idea that is most of the disease condition is a one-sided disease. So what is the one-sided disease? It is only a treating this disease condition based upon the common symptoms only. So when we treat the common symptoms, it won't be cured as per Hahnemann. So only most of the disease condition which we have, because we already Hahnemann classify the one-sided disease as well as the physical, as well as a mind or mental disease. Okay, so just because it is a vast and large topic. So just to explain out that it is a one-sided disease, important place is occupied by the local maladies. That is the changes and the ailments that appears on the external parts of the body. So why it is called as local malady? Instead of using the word skin eruption, Hahnemann why used means the old schools thought that part is only morbidly affected and the rest of the body did not participate in the disease condition. So what is the meaning for that one? Because now only it is not now only that they are treating the disease condition by the external ointment, but previously it was followed that one. Just imagine, it was happened in the 18th century. So 18th century is under the control of old school mostly. So here, Hahnemann mentioned that local malady means that based upon the causes, they just divide the local malady into two. One is the local malady due to the external cause and local malady due to the internal cause. So what is the local malady due to the external cause? So Hahnemann, we surprised think about that one. Hahnemann just to make the classification of all the injuries comes under the local malady. So here, but the lesion must be very trivial. That is the least important. In this case, it will be no great moment. For case of injuries, when it is occurs in the body, whole body is affected. At the time only, we can able to prescribe the medicine, but it is only related surgery. Because sometimes they are asking, you are a doctor, then why you are not treating about the needles and bandage and sutures? Okay. So because Hahnemann also, you already know about that one. Hahnemann wrote the book not for the students, only those who are practiced at the time. Most of the allopaths are follow that one. Our allopaths are converted that one. But now it is not possible to do with these things. So only some of the people are asking about the modern pharmacology is doing more thing like that one. But here we have certain own limitations. We are going not beyond that limitation. So first one is the needles and bandages. Because when there is any wound is there, when there is the what is called lips of wounds are there, it must be by the suturing. Then making an opening in order to remove an irritating substance. And also if there is any huge collection of fluids, because according to stored close, you already know about that one. We have some scope to that one. Okay. And also, we also apply our homeopathic medicine to the fractures. Yes, good. There is no doubt in it. But there is a bringing opposition broken extremities. It must be needed. Because the alignment of bone must be needed. Otherwise, it is not possible to cure. Okay. So what is the role of homeopathy in this condition? In sutures, and also the fractures, and also the dislocations, there is no homeopathic role. Because some of the doctors or some of our fellow students are also asking about that one. When you are a doctor, you must do all these things, but it is not possible to do. Everyone has its own limitations. When we are standing in our limitation, definitely we will shine about that one. So what is the role of the physician at the time? Okay. So at the time, when the whole body is affected and when we are having the fever like that one, then only we can use our homeopathic medicine. Otherwise, when the cause is external and also there is no scope of homeopathy in that affection. So actually, what is the meaning of the local malady? It is some due to the internal malady, because we already know about that one. What is by symptom? It is the external manifestation of the internal derangement of the vital force. So what the film which we taken a photo, it is nothing but a symptom. So here, some of the disease condition which not arise from the external injury, but it is also some of the condition. It is immediate exciting cause may be there. For example, there is in case of keloid, you know about that one. Some history of injury may be there. So keloid may develop into that one. So here, these affections were merely topical and so-called local disease. Maladies limited to parts wherein organisms took, that is the allopathic view. In case of local malady, the rest of the body does not involve in. So only they just apply the ointment for that one. Whether it's a good or bad, we can see in later. But it is the pernicious blunders of the old school. No external malady can arise. That is, when there is any skin eruption is there. When there is any warts is there, according to Hahnemann, no eruption is growing, persist, even grow worse without cooperation of the whole organism, which must be in the diseased state. So definitely, when there is a disease condition, it is participation of the whole. It is impossible to conceive its production without instrumentality of the life. That means if there is any skin eruption is there, definitely it indicates that there's some of the internal changes takes place. Oh, so what is the Hahnemannian treatment for that? Because it is a nowadays practical difficulty which we do in our practice also. Whether it is applicable to apply homeopathic medicine externally only, or simultaneous administration of the medicine internally, because I am not touching any of the medicine in this occasion. Whether there is any simultaneous application of the medicines internally as well as the externally. So here, first one is the properly selected internal remedy will annihilate the external remedy, because it is a confirmed way, unambiguous manner. What is me? You already know about the ambiguous, because the doubtful, unambiguous, without doubt. It is a powerful internal medicine immediately after ingestion. Because in drug proving, what we do, even though the person is not having any skin eruption, after intake of that medicine, that person start to produce the skin eruptions. For example, graphitis, you already know about that one. Or sulfur, or tuja, whatever may be the thing. For proving purpose, when we take any medicine, definitely it produces the symptoms outwards. Like that, the restoration of the health. If there is any skin condition is there, it is only improved and cured by the administration of the medicine internally. So here, select the medicine which is similar to the local affection, including the symptoms that were present before taking any treatment. So, because some of the few students are attending the seminar, it is for them only. Because as the homeopathy physician, you already know about that on how you treat that one. Okay, so when we see the local malady or skin eruption, we are not only give the important to local affection, and also the symptoms and sufferings observed in the patient's health and which may be previously noticed when no medicines has been used, and in conjunction to form a complete picture of the disease before searching among the medicines. Because we just take the complete totality of the symptoms. What is the physical general? What is the mental general? We just collect all the symptoms along with the local appearance of the symptoms. So local manifestations are inseparable part of the whole disease. Actually, local malady is inseparable part. It is also, it is include that, or it affects the mental general, physical general also. So how you treat that one? Okay, because by means of this medicine, we just employed only internally. Okay, so what happened when we take the medicine internally? General morbid state is removed along with the local affection, and later is cured at the same time is the form. Yes, when there is any skin eruption is there, what we do? We just take the complete totality of the medicine, and we just prescribe whatever may be the medicine. And when the symptoms start to disappear after intake of the medicine, it only indicate that that condition become cured. So it is an inseparable part. The next, Hahnemann denounces external application, because there is a view is there, whether in homeopathy we use the external application or not. It is always a debatable, because in some of the university questions we can say, or we can see, what is the Hahnemann view regarding the external application? Yes, Hahnemann also recommend the external applications in his aphorisms, in his philosophies, but in some conditions. What are the conditions? What are the different mode of administration of the drug? Particularly in very old age, Hahnemann recommend that external application of the same medicine which we use internally as well as externally. Severe chronic disease condition, Hahnemann also recommend that one. They apply the medicine, same medicine lotion form. For example, because you already know about the 6th edition of Organon, Hahnemann also himself explained about that one. For example, you just give the sulfur 0/1 or whatever may be the medicine externally, we also administer the same medicine, internally, same medicine externally. We just apply that skin. Because you also know about that skin is also one of the best respiratory organ. So the medicines are get observed. But Hahnemann, particularly in the 283 to 285, Hahnemann mentioned that, but when we applied that skin ointment, or not ointment, lotion externally, but we avoid the parts which are in the pain, spasm, like that. Okay, wherever there is a pain, wherever there is a eruption, wherever there is a spasm, you should not use that medicine. But unluckily, we just use the medicine externally, what Hahnemann banned about that one. Because it is external application, because it is also one of the mode of administration. External application, ingestion, not an injection, it is an ingestion, and also by the olfaction. But we should not apply any external ointment or medicine for the eruption. So only Hahnemann mentioned that it is not useful, the acute local disease of the recent origin is long time to apply externally, even though it is specific when used internally, salutary by the homeopathicity, even although must be same time advised internally. So first condition Hahnemann recommend, you just prescribe internal medicine only. Because some of the doctors, few of the doctors, not all, they just apply or just recommend the medicines. They just prescribe the graphitis ointment or graphitis lotion. At the same time, internal graphitis medicine, whether it is good or bad. Because sometimes they told, we are also prescribe the medicine based upon the symptom similarity. Because we also, because during proving, we just see administer the graphitis with skin eruption. Now the patient is the graphitis patient according to constitution also. Now we start the practice. That is, administer the medicine graphitis internally, as well as administer the medicine of the graphitis externally. Whether it's good or bad. What Hahnemann insists, no, it is not advisable. Because when you administer the medicine externally as well as the internally, what happens? No, the external medicine is automatically which is become normal immediately because it's a local affection. At the time, we just having a confusion whether that condition is cured internally or not. That condition is there because the God only make like that one. Because in future, because you already know about that one, that primary symptoms of the miasms. Because we won't think that primary symptoms of the miasm arise from the mind. According to Hahnemann, yes, he is the practical man. He just the primary symptom means the primary symptom of the miasm skin is the sora for the eruption, psychotic for the spots, and syphilis for the chancre or bubo. So here, in order to effect a radical cure, after acute cirrhotic has well subsided, an antisoric treatment must be given. So a remedy covering both internal or external manifestation, we just take the totality completely, and also we prescribe the medicine. So here just Hahnemann has given Book of Chronic Disease, mere topical medicines, powerful to cure given internally the local symptoms of chronic miasmal disease, quite inadmissible. There is a local affection of chronic disease. So here, so what is the reason for that one? And also, Hahnemann also in some conditions, they just recommend that psychotic, that is what is called, that is Puja mother tincture for the external application. It is also not admissible. So now what is the conditions? Because when we use any allopathic ointment for the disease condition, okay, so where it is goes, where the skin eruption is disappeared after the intake of that allopathic medicine. Just Hahnemann discovered that. He clearly put, because whatever may be the condition, when we apply any ointment for the skin eruption, that skin eruption present in our body is immediately disappear for that. So why it's so? Why it is disappear? What is the Hahnemann in view? What Hahnemann told, when you apply any ointment for that condition externally, it is just, it turns back into the nervous system. Through the nervous system, it just back or driven back to the system of the disease condition. So definitely it was the condition what Hahnemann told. So you should not apply any external ointment. So what we do by removing the external symptoms, the internal malady is getting worsened. If old school physicians should now destroy local symptoms by topical external remedies under belief cures whole disease. But what Hahnemann told in the last line, when this occurs, it is usual to say, though incorrectly, that local affection has driven back in the system for now by external remedy. So only when we apply any external ointment for that condition, allopathic ointment, immediately that condition is cured. So only we thought that why it is so. It because actually it is the only philosophical explanation. After intake of the medicine, it is driven back into the system. So here, it is the most criminal procedures leads to unnamed chronic disease about the use of the local affection. So it is the most criminal one. When we apply any external ointment, particularly Hahnemann mentioned that skin soric symptom by all sorts of ointments and burning away chancre by caustics. Okay, it is not advisable. So, and also we can say Because some of the conditions, Hahnemann told, why that skin condition is, why all the primary symptoms are appearing in that one, through the skin only. It is only basic, what is called the basic philosophies, Hahnemann mentioned that one. Why the skin symptoms are appearing first? Because when any chronic diseases attack us, if any chronic disease enter into the living organism or enter into the body, definitely it just affects all the organs. So the vital force have a plan and shift that more affection of the internal organs to the external lesion. So only the skin symptoms are appearing. It is only Hahnemann philosophical explanation. Vital force adopt a plan. So we should not suppress by that ointment. Only that internal medicine is cure the disease condition. Because even though this local malady is a small chapter, but it has a more practical value. Okay, thank you. Thank you very much for all the persons who are giving the opportunity for me to attend this. Thank you. Thank you very much.
Thank you, Doctor. Now there is half an hour remaining. But those who want to ask questions, you can ask questions. Please raise your hands and. But somebody. Normally, I use medicines, local medicines, means Tuja ointment and Tuja mother tinctures for using to remove warts and all. That time it is very much effective. But if I had many experiences, but there will not be any new symptoms or anything like that came to in the future time. It's completely cured. But yeah, internally we give medicines that at the same time I use it. So Hahnemann said all these things in 200 years back, 250 to 25 years back. But the medicinal uses used that time and the medicine used this time is, I think that the medicines are all, there are so many advancements in the medical science. So do you think that the same principle, the principle is it is right, but the medical application, if I say, if I give sulfur, please, sulfur, give sulfur and the action is coming from the inside to outside. The side issue also having to open the area. It has a quality to open. We know that it is used as a surgical weapon. So at the same time, what will be the effect, sir?
Actually, in that condition, just that surgical knife, yes, yeah, it is a silicea, they mentioned that. But in that abscess, we just take the medicine internal only. That internal medicine only, I think it is makes the ripen. Whatever may we think when the belladonna or eparsal for mersal, instead of using that external application, even though we are taking the mersal 30 or lower potency, because in organ they mentioned that, or mathematics also they mentioned that lower potency has and that is increase the suppuration. So what maybe that is in future, because in many conditions what we think that fast cure. As a De Silva sir, you may be a senior for that one, because practically we can say, because some of the conditions, particularly in skin eruption or in what is called any gangrene, when they apply the ointment, at the time we are in the confusion whether that disease condition is cured or not. Because it is not only happened now, it is also persist even before that time. Yes, please.
Sir, one telephone came to me. So,
Sure, please.
okay. Okay, sir. Anybody want to ask? Please raise your hands. Okay, sir. Unmute. Okay. Dr. Mas, please unmute. Sir, Ram per sir. Okay, okay.
Oh, yeah. Thank you. Thank you, Dr. D. Charanannan. Very nice class. Beautiful. According to law of organisms, according to law of homeopathic science, main cause of disease, mind. Main cause of disease, mind. And fundamental law of Shura, psychotic and syphilitic. Tick the mind, nor the local malady. Eruption, cause of mind. Eruption, local maladies, applied external medicine, the suppressed disease, other change of disease. So very nice. According to law of homeopathic science, when cause of disease is the mind. माइंड ही बीमारी का कारण है, अध्यात्म में भी कहा गया है कि मेन कॉज ऑफ डिजीज माइंड, अकॉर्डिंग टू होम्योपैथ शास्त्र में भी कहा गया है, जो है फर्स्ट ग्रेड ऑफ सिम्टम माइंड, एंजाइटी, लोभ, एंगर, टिक द वाइटल फोर्स फ्रॉम, अकॉर्डिंग टू होम्योपैथिक मेडिसिन, support the vital force. Vital force, a strong disease, yeah, eruption, internal to external. Curative way of treatment. Local malady, it is a fine disease condition. So, very, very thanks. सुनो होता तो मानस रोगा, जिनसे दुख पा वही सब लोगा। मोह सकल व्याधिन कर मूला, तिनते पुनि उदय बहुसुला। में बात कफलो पारा, क्रोध पितमित छाती जा रहा, तीनों भाई करही प्रीति उपजहि सनपा दुखदाई। तो थैंक यू, वेरी नाइस।
Thank you very much, sir.
Okay, thank you, doctor. Now,
you.
Dr. Mas, you can talk now. You can ask question or
Yeah, thank you, Dr. Hubert. Thank you, Dr. Darini, for the sharing. Your explanation is very clear about organon. My question is pertaining to your experience in treating skin eruption, where the application of organon has resulted in fast results, good results. Can you share with us any of those cases, if you may?
Pardon me, just I couldn't understand, ma'am, please.
Yeah, my question is, the sharing of on organon is very good, very interesting. I would like to know if you can share any of your successful cases in treating skin eruption. As you know, skin eruption is quite challenging. If there is any cases that you can share with us, perhaps that would be very beneficial. Thank you.
Actually, in our college OPD or in my clinic, just I treat that skin disease, but it is not, I am giving any ointment for that one. Particularly, the patient is mainly they are asking about that, what is called that ointment, but I am not bothering about that one. Just to take the complete case taking. Because being I am the staff of that organon, it is not possible. Actually, I won't use that external ointment. Only I use the internal ointment. But only 200 potency is used. Because even though Honeyman recommends the 6th edition of organon, So I think most of the doctors are there here just to give the guidance that using of the 50 millisievert scale of potency. Mostly difficult to use the 50 millisievert scale of potency, even though it is considered the latest potency. But we are not using the 50 millisievert scale of potency like the 30 or 60. So mostly when the disease condition is local, for example, some of the conditions may be cured by the sulfur 30 because being the local affection, then we can change the medicine accordingly. Because one of the cases there, it is nicely oozing. That patient is coming with me. Actually, after intake of that allopathic medicine, they have the skin eruption recurring again and again. But it is a typical graphitis one. But when we use the graphitis, it is very much cautious to use that one. Because sometimes as it is an great antisoric remedy, it gives the aggravation. So here first is just I give the, it is happening when I was studying in that BHMS at the time. Actually, I just watched my staff regarding that one. Because after prescription of the graphitis 200, only one dose at the time, it just to give the aggravations, quick aggravations. Then he just followed by, because then he showed that there is a homeopathic aggravation. Even though in our practice, we can see minor case of the skin eruption for the any external, for example, warts are like that one. Okay, mostly the nitric acid, mostly in the tuja. Particularly last week also I had one case in my clinic. There is in finger they have the one warts. So it is just like that, the thick horny warts. It is only like that of the anti-crude. But they have the many warts in the what is called the palm. Just I prescribe the anti-crude 200 for weekly one dose followed by SL. So unfortunately, the patient is disappeared from me for the last 2 or 3 months. Then again, after 4 months, he came and he told that it is a what, sir? That is is cured. That is cured means there is a disappear from the place by the internal medicine. This is my experience, what I see. But when I was in college at the time, just I saw was they gave single dose of that medicine, sometime giving the many aggravation, particularly in skin eruption. We are very much cautious to prescribe that. Particularly, we already know that sepia and also that what is called, usually they have the eruption, fungal infection, you already know about that. It is very dangerous condition also. We can say that fungal infection, but in allopathy, they just prescribe many of the tablets for that one, antifungal. It is also maybe injurious to them because many of the persons are, we can say, died due to that effect of that medicine, fungal, antifungal. Those who are suffering with that one are those who are treating that, they know about that one. So I also having one case that, so I just prescribe sepia based upon that skin complaint as well as the internal. It was nicely give the cure. Okay, so because each physician having that own experience of skin eruption, but because Hahnemann was very much bothered about the local malady. It is not only now, it is also prevailing at the time also. So don't prescribe, it is my idea, it is only my request. Okay, don't prescribe blindly that skin ointment for that any disease condition. Definitely it aggravates that. It is not like that, the acute condition for the fever or cough like that.
Thank you, doctor.
Yeah.
Thank you very much.
Doctor, you said this. Then what we do in such cases?
For which cases, sir?
In the fungus infection cases.
But only the internal medicines. Because it is as per the only internal medicines, it will cure. It definitely the fungal infection, along with the hygienic condition, then only it will improve, sir. And also, as per the diet and regimen is also play an important role, I think so, in the fungal infection. Because we can apply that sepia or sulfur or whatever may be the external application. But definitely, most of the fungal infection, when it is not treated properly, it will recur again and again, sir, with an increased intensity.
But in candida infections, sir, have you what about the treating the in sugar cases? The sugar condition is more diabetic, highly diabetic cases. There will be candidiasis. And what is your plan of treatment and the success rate? I want to know the success rate.
Actually, I am not having any idea regarding that, but unless otherwise we can reduce the sugar level by any of our medicine, definitely I think it is not possible to treat that Candida. Even though it is Candida infection may be cured or may be removed by the external application, by removed that our medicine, when the person is having that diabetic, it will again comes, I think so, sir. It is the most
Very
vulnerable
difficult.
case, I think so.
Yeah, it is very difficult for us to
Yeah.
manage. So that
sure.
time, I think that they are giving allopathy, you know, that they are giving allopathy ointments and everything. That, but the cure is there will be the, I think that in such conditions, most of the cases will be cured.
Oh, fine. Okay, whether you apply the external lotion or how you apply for that, sir?
They are using, there are some ointments for Candida, like that ointment. They are saying
Homeopathy, sir. Homeopathy, how can we treat that one? What is your
But
experience regarding?
I feel very difficult for me to cancel. That is why I ask you.
Okay. Unless otherwise, we just reduce the diabetic. Because some of the case, because we already know about that one, some of the case, if it is not possible to treat by us, we can simply, that's just, instead of taking the risk for that case, we just transfer the case. Because unless otherwise, we can able to reduce that sugar level. Definitely that Candida's case is not able to cure. I think so, sir. Yeah.
Is it a limitation for homeopathy?
Definitely, certainly, sir. Because definitely, certainly, because when we did a scope of homeopathy, because instead of that our student was told to know, before we do, because before we know what are the cases possible to cure, first we know what are the cases impossible to cure. Because definitely we are having, each and every system has its own limitation. It is not possible to criticize any other systems. Each system has its own benefits. Each system has its own drawbacks. So particularly, we also having the own our limitation. Because some condition, because some of the doctors are treating the cancerous condition. Yes, well, there is no doubt in it. But in the advanced cases, it is not possible to give the sure regarding that one. Because most of the structural changes takes place. So it is not possible. We are also having the own limitation. What is your view, sir, regarding that?
Yeah, I am a cancer patient 5.5 years back.
Oh, fine. Okay.
That time, that is clear cell odontogenic carcinoma of my cheek, the bone. That time, 6 doctors in Kerala, the eminent doctors of the medical college, RCC, and Kim's Hospital, doctors said that you had to remove half of your mandible immediately. Then after that, they will manage with, that is the first condition. I have to remove my jaw, half of my mandible. Then they will start treatment. From taking a bone, from grafting and everything for, that is a continuous work, they said me. So I have to go for the first treatment, cost will be 7 lakhs. After that, there will be a continuous treatment for bedridden for me, for a hospitalization and everything. But because of that, I said, you know that a doctor having a 25% face will not be there. What will be the doctor's condition? So I decided, whatever it may be, I am not going for a surgery. I am taking homeopathic medicine and still I am living. I become a grandfather and I am doing the moderator today. So I am doing the other, our videos are every day I am uploading and doing all these things during these 5.5 years.
Whether you're taking medicine yourself or just you can
No. One of my doctor here, our treasurer, Dr. Anil Kumar is giving me medicine for that. So I am a living person to say this testimony for all of you. That I think that I used to take cancer cases, but that is very, I think that we can do many things.
Which stage you are having, sir? In which stage? First stage or second stage, third stage of the cancer? Whether it is started to spread it or
Yeah, it is
Government.
started. It was started.
Oh,
Started to spread. That is why their doctor said that you have to immediately remove your bone, otherwise you will die.
Ah.
So I think that die with jaws is good than die without jaw.
yeah. Okay, fine.
So that is my testimony.
Sure.
So we can do on Dr. GHG, that doctor, one doctor said that LG, Dr. LG, he was
Okay.
treating, you may know that 95% of the cancers can be cured with homeopathy.
Oh,
He
in
is
all the stages.
yeah, he told that
Oh, fine.
he's an American doctor, LG. He treated 20,000 cases in different stages and every types of cases he treated. And he said that if they are not touched, not operated, 95% of cancers can be cured.
Oh,
So that is what I want to say. So
super, sir.
Dr. Danesh is there.
Now only I heard that, because mostly they are just having that fear about that, because when that cancer is spreading inside, and also when they mostly that patient won't come directly to us. They are always go to the radiation, all chemotherapy. After that, they only just last stage only most of the people are contact us. So at the time, whether it is possible to do anything, sir?
Because we know that while taking these chemo medicines on 180 days, there will not be any regeneration of our metabolism will be lost, because they won't allow that to our body building will not be happen. That time they are giving that 6 months of treatment. There will not be any growth in our body.
Oh, fine.
So that is why I did not take any treatment, because with my health, I can treat. Without our health, if we are losing by taking these allopathic medicines, they are completely stopping all our maintaining of our body. That is the chemotherapy.
Okay.
That is why their patient become a small, lost everything, hair and everything, his body, everything will be lost after taking the chemotherapy.
Oh.
So that is the condition. I think that with his health, we can treat. That is what we can do in homeopathy. With his health.
Okay.
So I say that after that I have treated many cases of cancers, and it is very easy for us. I think that.
But that
if they are not going there.
What about the radiation, sir?
Why should we go? Let them live with us. We should take them the cases. If there is but the consent of the patient is very important.
Yes.
If he is content, he is ready to take our treatment, then I think that it is easy for us to treat.
Yes, correct.
Okay, thank you. Dr. Danesh, you have to say something, I think.
Dr. Amit Kumar Sinha want to say something. He can speak.
Yes, ma'am.
I want to ask that is there any cure for protruding piles, which is just like cauliflower?
Is there any cure for piles?
Yeah, protruding piles. Is there any cure for protruding piles looking just like cauliflower?
Just like cauliflower. Sir, it is coming out just like cauliflower.
Okay.
Yeah.
That's the question. We want to know about that.
So now it comes under the external, no? Sir, what is your view, sir? Dr. Silva, sir?
Yes, sir.
Yeah, it is treatable. But inside, okay, Dr. Danesh is an experienced person. He may talk.
Yes, sir.
Yes, it is only group discussion only.
Yes, sir. Definitely, we can go ahead and treat the patient. We have many patients cured with homeopathy in protruding piles. But when it becomes fourth stage, it may be we may have some difficulty. But if it comes either a second, third, or stage, we can definitely manage. But the thing is that the person should take care of food and everything, and he should a proper diet. everything is because nowadays a lot of people are using this non-vegetarian diet without any control. They used to take a lot of packed food items every now and then, and they are not bothered about what are the things inside it, and that may be one of the reason. And of course, people used to take a lot of cigarette, alcohol, all this thing also. I have a case of protruding piles with a person who used to take alcohol as well as at least 2 packets of cigarette a day, but still we were able to cure the patient. Everything everything went inside, and he's construction. He's working in the construction field, and he's doing his normal life. Even now, he used to take 2 pints of liquor, but still with the homeopathic medicine, we were able to cure them. Even at the time of treatment, it lasts for about 1 month. And during the time itself, he used to take this cigarette without the knowledge of the family in the toilet. But still, we were able to cure, because that is the beauty of homeopathy. There are certain obstacles in the way of cure, but we have to remove that obstacles at least for the time being, and we will have to ask the patient to do certain things. And I just asked him to take some rest, and during that time, he used maximum vegetable fruits, food as well as fruits. The person should take maximum quantity of fruits. Am I right, sir? Cheramannan sir, what's
Yes,
your
sir. Yes.
our
But the
medicine-
diet and regimen plays an important role, I think so, sir. In
Yes,
terms of that, yeah.
diet and regimen as well as our medicines also have a big role. Definitely, our medicines, particularly the specific pathologically, you can give pathological prescription in those conditions, and even then we can go for the constitution, because all those things indicate the person is alcoholic as well as the cigarette smoking. All those indicate a person constitution also contribute to lycopodium. But the constitutional medicine was lycopodium. But still, I have to give some pathologically advanced, since the case was advanced one. I have to give some allostinger.
Oh, okay.
To manage the condition at the time, as well as calcarea floor 6X. These 3 medicines done a wonderful job for him.
Allo's mother tincture by the internal only, yes, sir?
Yes, sir. That's only internal.
Internal.
10 drops 2 hourly.
So which mother tincture have you given?
Allo's.
But do not do the same thing to every patient. You will have to. That's the basic difference between homeopathy and the other system. They can go in all, but you won't expect all cases to be successful with the same prescription. No. You will have to find the constitutional medicine first, because that person's nature itself was like a podium. As you know, a person who is having too much of cigarette, definitely lycopodium can work. His constitution was very slim, and just like it is not a fatty man, but still his prolapse is much bigger. And so also the alcoholism is there in lycopodium. All those 3 things combined together make it a successful case.
In such cases, I think that, doctor, please, sorry to say, in such cases, we can use Tuja ointment for the local application.
Okay.
But I didn't apply any ointment, but instead I asked the patient to sit in simple water, in salt water, to every half or about some half an hour 3 times a day. And that really works for him.
Thank you, Dr. Indranil. Okay. Doctor, please unmute and ask. Raise his hand. Okay. Okay, doctor.
Can you hear me, sir?
Yeah, we can hear.
Okay. Thanks for allowing me. I'm Dr. Bavdekar from Pune, Maharashtra. Yeah. Firstly, I will say that I heard your case of mandible, and I am very happy to see that you are doing well with homeopathy. And my all good wishes for your further improvement. For sir, there is a question. What happens? So for everyone, like in skin complaints, there is a dryness of skin. This is a chronic, or you can say recurring demand from the patients. They want ointments. So here, can you hear me, sir?
Yes,
Yeah,
sir.
yeah, we can hear.
Yeah. Here, what we do, we ask them to apply coconut oil to lubricate their skin. So actually, as per the organons, like will it amount to suppression of skin or what? That I would like to know your views about that. Secondly, nowadays in the last 20 years, I have not seen a single case of chancre. Probably higher antibiotics are there. So how to recognize syphilitic miasm in skin diseases? These are the two questions for you, sir. So can you guide us for that?
Actually, previously that syphilitic ulcer is common, no? But it
No,
is not.
syphilitic miasm, sir, miasm. Ulcers are easy to identify because of their irregular edges, their punched out edges. But in case of skin complaints, how should we recognize a syphilitic miasm dominating?
In skin complaint.
Uh-huh.
Mostly they mentioned that in honeymoon period, there is only chancre or bevo is there.
Yeah.
Mostly it
In
is in
our
the way of the
generation, it is not
genital
there.
organs.
Yeah.
Because now also we can able to see the two things. That is only either psychotic or psoric.
Okay.
It
So
may be.
we should not worry.
Pardon, sir?
No, but sir, sometimes what happens, there, according to the basic syphilitic miasm, basic key points of miasm also we see in skin diseases. For example, rapid onset, intensity in like the symptoms, many time destruction. For example, albinism cases are said to be syphilitic because there is no color in the skin. So, what are your views about that? Can you guide us?
Actually, albinism is also very difficult, as well as leukoderma, because whenever there is any skin condition with the vigorous symptoms, we can able to treat. But like that as albinism, particularly if it is due to any congenital, I think it is very difficult to pass. If anybody
but the
is having the experience
miasm is
to treat,
syphilis.
miasm is syphilitic, but if it is a congenital.
Okay.
I think, sir, what is your view, sir? Others' view, just we can be able to share about the problem. Because some of the condition is there. We can say that leukoderma or albinism.
Yes, you're absolutely right, sir.
Secondly, in case of, I'll tell you, other systemic diseases, we have seen vasculitis in patients here in Pune, which I consider them as syphilitic miasm. They occur acute and their intensity is very severe. And there is a rupture of the small blood vessels also, leading to small hematomas or discoloration of the skin. So, what are your views? Any additional I would like to have from you? We'll be happy to hear.
So, what about this, Daneshar? Your view regarding the problem? I am not having any experience with this condition. What's that told?
Okay.
Frankly, I can only speak about the experience only, sir. We have, I cannot explain the miasm behind those things because I am not a person who is having a very good depth or in these miasm theories. So that may be the thing. He is a person. He wants to know actually the theories of miasm and how it works in this particular condition. I think that even though the condition, it is a syphilitic condition, I think mixed miasm is working in that case. It is not a simply syphilitic case or a psychotic case or like that. There is a mixed miasm in that case. So sometimes you may require some acute maladies for that. Am I right, sir?
Yeah, sir. Sometimes psychosyphilitic are also seen. Psychosyphilitic are also seen.
Okay. That is the thing that we will have to look for a remedy in a condition. Sometimes you are treating a patient with a chronic problem, and that there's at some time of treatment you may require an acute remedy that may be a psoric one. Then sometimes that alone it won't affect the miasm destruction. The theory will works. The same medicine will act in the same way. not the acute remedy, the medicine you are taking earlier will work automatically. That will give you a stimulus, I think. Am I right, Chairman, sir?
Yes, sir. Because still research is needed, I think so. Because what Hahnemann did, we just stop there only, I think so, sir. Particularly using the 50 millisievert scale of potency, I don't know about the practice of the 50 millisievert yourself. Mostly here, the 50 millisievert scale of potency is not used. But it is, even though it is acted very nicely.
Yeah.
Because due to the cultural and also due to the fast people, they are not able to use the 50 millisievert scale of potency. It is mostly applicable when we admit the patient as the inpatient.
Okay.
So when we discover, sir, what are the syllabus, sir? Any idea regarding that one?
Okay,
Your
sir.
view regarding the 50 millisievert scale.
Sir, our
Because
time is already
time is over. So
Yeah,
let us
okay.
have a
Because it is a great discussion about that one.
yeah.
Because even though it is usually follow the latest one, but it is not possible to use the latest. So in future,
Sir,
Sir,
can you highlight on coconut oil, because that is routinely used by patients also for their skin complaints?
We should need an explanation from for everything. Whatever we see, we have to observe it, and we have to take it in an explanation of homeopathic explanation is needed.
Correct.
That
Will
is
it,
what
and will
that's
it amount to suppression? Will it amount to suppression of skin problems? Coconut oil.
No, it is sometimes it may be a nourishment. Nourishment
Yeah,
will not
many
be a
times. Very true.
suppression.
Very true. Very true. Very true.
Nourishment will not be a suppression. It is a needed
Okay.
for our skin. That may be.
Okay.
So our time is over. So let us have to go to
Thank
our
you, sir.
Malayalam session.
Thank you. Thank you.
Thank you, sir.
Thank you. Thank you very
Thank
much,
you,
sir, for
Dr.
the- Thank you, sir. Thank you. Thank you.
Yeah, tomorrow we
very nice
will have
presentation.
a session from Dr. Asha.
Now we are concluding our session. Here we are going to our Malayalam session. I invite Dr. Shaila to do the moderation.
Okay, thank you all doctors in English session.